How many of you listen to public radio? Great. I can always tell a public radio audience by the way you're dressed. No 3-inch spike heels today. When Paul called me up and asked me to talk a bit about health literacy, I said, what do I know about health literacy? I really don't know anything about health literacy. And he sort of talked me into it and said, well, what you do is you really talk to people about pertinent medical problems. And the more I thought about it, the more I realized I do have some credentials in health literacy. And I've done a lot of thinking about this. We're going to go through a number of slides that I hope will begin to pique your interest on what you can look for and look at to make your health literacy activities better. But before I start, I want to tell you a story that occurred this weekend that was clearly a health literacy issue. My neighbor got into an altercation with a bandsaw. Bandsaw 1, John 0, St. Mary's Emergency Room, University Hospital, 3 fingers the tips, big problems, thumb had to be reattached. Major issue, dirty wound because it was a bandsaw and he was working with wood. So the next morning, his wife, Carolyn, called me up. I didn't know about it, and she said, John had an altercation with the bandsaw, and he's nauseous. Can you come over and help? And I said, sure. So walked next door. He had been taking some Percocet. He doesn't take painkillers. Percocet makes you nauseous. And I said, that may be the issue, and pain makes you nauseous. And so as I was reviewing things, I said, what's he on? Is he on an antibiotic? And they said, yes, they're worried about an infection. And he's on an antibiotic, and it says take 1 tablet twice a day with food. And I said, okay, when did he take the last pill? He said, well, I haven't given it to him because he's nauseous. So she didn't give it to him last night, and she didn't give it to him in the morning. Take 1 tablet twice a day with food. Is that health literacy, or is that not health literacy? Both have gone to college. That's the issue. It's right there in a nutshell. So he might come into the doctor's office, and it might get infected. Let's just make that as an assumption. We as a doctor would assume, well, the antibiotic isn't working. Because we'd say, oh, did you take your pills as directed? Sure, I did. I took my pills as directed. And I just mentioned it because it's beneath the surface, and it's a very important issue. If you Google the Archives of Internal Medicine article that came out a few years ago that looked at health literacy issues in senior citizens, this was a study out of Chicago, 4 urban areas, studies out of Chicago, looked at people who were health illiterate and health literate, and they had a way of testing them. It turned out that senior citizens who are health illiterate have an increased death rate, dramatically increased death rate, nearly 40 to 50% greater for whatever disease state they have than senior citizens who are not health literate. In other words, health literacy is a major cause of death in this country, and it's not recognized at all.